This is the Fertility Friday podcast, episode number 87. Today's episode is brought to you by my new Fertility Boost group program. My group program includes 6 to 8 women who are also looking for a deeper understanding of fertility awareness and wanting to improve their cycles naturally. If you're listening to this episode in real time when it's actually being released, registration is opening on July 25th. Make sure to head over to fertilityfriday.com/programs for more information and to reserve your spot. If you're listening to this episode after July 2016, head over to fertilityfriday.com/programs to find out when the next group is starting and to get on the waiting list. Welcome to the 87th episode of the Fertility Friday podcast. Thank you for joining me today. I'm Lisa from fertilityfriday.com, and this is your source for information about the fertility awareness method and all things fertility. I started this podcast because I believe that every woman has the right to know exactly how her body and her fertility works, and I'm here to connect you with the tools and information that you need to improve your menstrual cycle health and your fertility. And I feel so privileged to be able to share my passion for body literacy and fertility awareness with you every week. Fertility awareness is so much more than just birth control or trying to get pregnant, because it truly gives you a window into your own health and fertility, and I love sharing my expertise with my clients and helping them to understand their charts and connect with their cycles. If you've recently discovered fertility awareness but you're not feeling confident about using it for birth control just yet, or you've been charting for a while and you're having trouble making sense of what's happening in your cycle, I can help. Get started today with a free 15-minute consultation with me by heading over to fertilityfriday.com/coaching, or just click the Work With Me button on my website. And I would also like to invite you to sign up for the Fertility Friday newsletter. Head over to fertilityfriday.com/ebook, and as a gift to you, you'll receive a free copy of my new ebook where I reveal what to expect when coming off of hormonal contraceptives, and I share 5 steps to restoring healthy menstrual cycles post-pill. And today I'm very excited to welcome my guest, Ariana Taboada, to the show. Ariana is a maternal health consultant who works with women to create a smooth and personalized transition into motherhood. She is a maternal health researcher and social worker by training, and her expertise lies in postpartum planning and social support during early motherhood. She is deeply committed to providing support for new mothers as they enter into the postpartum period and beyond. This is something that I've touched on several of my previous episodes, because women often focus so heavily on fertility and getting pregnant that many women don't spend too much time considering what the postpartum period is going to be like after the baby actually arrives. And I'm really excited to talk to you today, Ariana, because we're both in the postpartum period. So I think I'll learn quite a bit from you as well. So we'll be talking about what happens after the baby arrives and why it's important to build social networks, and also what that transition back to work might look like. So without further ado, welcome to the show, Ariana.
Thank you for having me, Lisa.
Well, yeah, I'm really excited to talk to you. I feel like I'm going to end up picking your brain, like, selfishly because I have a 9-month-old. So I'm at that stage. We talked about this a little bit, but in Canada, so I get a year of maternity leave from work, but you live in Mexico. But before, yeah, so it's a little bit different. So maybe you can introduce yourself and talk a little, professionally, of course, but also personally as well.
Sure. So it does seem like this is going to be a great show where kind of the personal and the professional definitely converge, which is kind of sums up postpartum, maternity, identity around motherhood, and work, career related things as well. And as you mentioned, I have a little 3-month-old right now. And so I definitely am coming into this conversation with some of those more personal aspects fresh on my mind. And my background is, as you mentioned, I live in Mexico, where I mostly work on maternal health disparities, but I also have a small private practice where I apply a lot of my training from the U.S. I'm U.S. trained by the U.S. Maternal and Child Health Bureau. So I apply a lot of what I learned in a more health professional oriented setting to working one-on-one with women and thinking about that phase that, is the term has been coined the fourth trimester, but really, all the way to where you are now, 9 months into it, a year into it, and thinking about how that phase can be so different for everyone, and what are some of the things that we can learn from best practice, from personal experience, from the research that's available about how to make that period as smooth as possible.
Well, so, up until you reached out to me, I didn't really know that there, was such a thing, right, as a maternal health consultant. I mean, I know about doulas, and I've heard about postpartum doulas, and I know midwifery care extends, at least to the first month or two, if you have a midwife, at least until the first month or two, but that is centered more around baby, whereas then the doula is centered around mom. So what does a maternal health consultant do?
Sure. Well, my training and what I like to think of as kind of the role that I can play is in convening support systems. So as you mentioned, there's usually great support for like baby's needs. There's usually like a postpartum doula would specifically support mom and family needs. And I like to think of the rest of the support system as also necessary, but somewhat missing. It's a gap in many maternal health systems across the world. But it's things like, well, what kind of support might you need with it that someone within your family could provide? What kind of support might you need that someone within your community who's not a family member could provide? When do you need to move from community support to professional level support? So it's kind of looking and mapping out and being able to think critically about all these different complex layers of how to support the mother. And lots of, so this isn't like a new idea. Lots of cultures around the world have this kind of mothering the mother approach. But in our modern day world, it seems to have been a little bit lost. And sometimes, there's a postpartum visit here with your provider. There's a mental health professional if you need it, and there's stigma attached to that, right? But the just having a strong support system in place isn't something that is readily available to most mothers. And speaking from experience now, it's definitely necessary.
Well, it occurred to me that, so you've been working in this field then for quite some time and supporting mothers as they transition into motherhood. And so as a new mother yourself, very fresh, everything's very, very new. At the 3-month stage, you're still not sleeping at all. Right. Unless, I mean, maybe you are, but I wasn't at three months because, it's just the age. How has actually then transitioning into motherhood yourself changed your perspective on the work that you do?
So my training and most of my work has been very focused on connecting mothers to the right professional network. So it's, I kind of know like the back of my hand, all the different types of professionals that a new mother might need to be in contact with, everything from a mental health professional to a pelvic floor physical therapist, kind of the range of people you might need in your life postpartum. And it had been drilled into me that professional support is incredibly important. And it is. However, now I found that having just regular, new mom sessions in person, having a group of peers to meet with has also been so important for me personally. And that was something that I don't think I held at the same level as professional support, but now I would say is equally, if not more important.
That's really interesting. When you were talking about all of the medical professional support that you could seek, the only thing that came to my mind is that right after you have a baby, you're really tired and really busy. And it's a different kind of busy. It's hard to explain I think that so one of the themes that has come out in a few of the different podcast episodes that I've recorded is just how important a mother's health is going into pregnancy. So when we talk about different struggles that maybe a woman's having when she's trying to conceive, if she's struggling with, adrenal fatigue, if she's not at an optimal stage of health, if she has a thyroid disorder, then going into pregnancy already sick and then having the baby, you just can't comprehend the toll it takes on your body. Like, it's kind of hard to, so one of the examples that comes to mind is, when I would go back to work in my regular job and people say things like, oh, so you're off for a year. When you go on mat leave, you're off for a year. And I often,
at home doing nothing,
right? And I often think to myself, have you ever considered what it would be like to have a job where you're on call 24 hours a day and for anywhere from 4 to 6 months? And some people would argue like the rest of your life, but hopefully just, that 4 to 6 month period, you don't get more than like 3 hours of sleep at one time. It really takes a toll on your body. So when you were talking about professional support and going to all these professionals, I'm thinking like, all I want is a nap, dude.
Yeah.
I'm not going out the house and like doing my hair. I can barely get a shower. So what I need is like a girlfriend to come over and like hold the baby while I take a nap.
Exactly. Yeah. Even having, I was lucky enough to have a midwifery team who did all my postpartum care at home, who came to me every single appointment. And, I could not imagine, every time they came, I was like, I can't imagine if I had to leave the house right now. I would not have gotten to that appointment. Sometimes.
Mm-hmm. Yeah, no, I could totally relate to that. And I really appreciate that. I really appreciated that about having the midwives come to my house for the first several appointments to check on the baby. So part of what you do then is talking about those postpartum support networks. And so you found that it was actually support from other moms that you ended up, needing and appreciating even more than you thought you would have. So maybe you could talk a little bit about why it's so important for new moms to have support and why having support from women in the same stage as you is actually really helpful.
Let's see. I'll again rely on my personal experience, but bring some of the maternal mental health training to the conversation. And I honestly didn't find a group of moms that I kind of fit well with until a lactation counselor that I was working with kind of directed me to the right place. So just because it's a group of moms, of like-minded moms, doesn't mean that it's easy to find, right? So I definitely think it takes work and effort, which can feel like a lot of work when you're sleep deprived, to find that circle of like-minded moms. And once I found that group, I think literally a few of the moms, the first time we met in person, it was like, okay, when's the next time we're meeting? Because I really want to get out of the house. And so for your basic mental health of like getting yourself out and moving in the world with this new part of you, I think that on like the most basic level of like, okay, I'm going to take a shower, get out of the house, drive in the car with my baby, all of these things that we kind of have to relearn how to do with, a new mentality, a new time frame, new expectations, that it's like taking baby steps on all the things that we did so easily before.
Mm-hmm. Well, and maybe you could tell me a little bit about what your experience has been like in this respect, but I find that talking with moms who are in the same stage, and I think that this goes for anything. I think that if a woman is struggling, say, for example, to get pregnant, it could be helpful for her to talk to other women who are going through the same thing at the same time, because then there's just a certain level where you can relate to each other, where even, you have great support systems with your friends, but there's that other level of kind of camaraderie and understanding that comes with someone who's at the same stage as you. I think that there's a lot of things that it's like anything. Until you've been there, there's just a lot of things that you wouldn't really have experienced before. And even if you read all the books, it's hard to understand the feelings that come with the challenges that come from motherhood. So you can talk about what sleep deprivation is like, but it's hard to describe like how you feel, the feeling of being really sleep deprived. Or if you happen to have a baby who's really challenging and cries all the time, because some women have babies that cry all the time. Or even if you have a baby that is super chilled and cries like at a certain time of the day, every day, for a certain number of hours. So it's, again, you can read about stuff like that and hear about stuff like that. But when you actually are able to connect with other moms, I feel like it really helps you to normalize what's happening. So you don't feel like you're the lone crazy person having this really challenging experience. You can know that other moms are having it too.
Yeah. I mean, the cutting down on isolation is, in the mental health world, we talk about isolation as being a huge risk factor. But in like the day to day, feeling alone is not fun. So anything, like you said, anything you can do to normalize the things that are so pronounced on your day to day with a newborn. The crying, the cluster feeding, the, going on an hour and a half of sleep is incredibly helpful to just have that peer group, especially because, I don't know at what point the weeks, even short weeks in short differences in how many weeks your infant is make a huge difference in what's going on in your day to day. So I found that, within like a month, 2 weeks to a month time frame, so much can change.
Yeah, absolutely. So breastfeeding is a good example of that. If you have challenges with breastfeeding, it can be so horrible. It's hard to explain how horrible it can be. So I remember before I had my son, you hear about breastfeeding, and sometimes women will be like, oh, breastfeeding can be really hard. And even to the point that I've had conversations with friends, before and after they had children of their own. And, for example, a friend of mine, before she had children always said, I'm going to breastfeed regardless of what happens. This is what I'm going to do. And kind of going into it with the idea that if a woman has challenges with breastfeeding and then has to stop, that maybe she wasn't trying hard enough. Not to be rude, but I'm just being like, she wasn't trying to be rude, but that was actually how she felt. That was just how she felt about it. And I think a lot of us we all make judgments about situations that we've never been in. And then fast forward to, when she had her first child, and she had like serious challenges with breastfeeding, severe pain. She had to see a bunch of lactation consultants. So then, now if you were to talk to her, she would say, wow, I totally understand why women stop breastfeeding, especially if they don't have the support that they need. So just certain things where you even go into it having certain opinions, and then your experience I'm kind of like going on a tangent here, but I feel like motherhood has really changed the way I look at a lot of different situations as well, because before you have kids, you can be super judgy about everything. And then when you have children of your own, you kind of I have started to soften and just really appreciate moms wherever they're at, regardless of what their choices are, because you really understand why moms make the different choices they do. So that's a really long tangent, and I don't know why I'm going on and on so much, but I had a question in there, and it's not even related to the tangent. But I wanted to ask you about, you had touched on how certain cultures have it worked in. So I know there's certain cultures where they have different cultural practices. For example, in certain cultures, after the baby is born, traditionally you wouldn't leave the house for, several weeks or 2 months or something like that, and the mom's being pampered. But typical North American culture, that's not really how it's looked at. Often you'll see images of stars on TV, getting their beach body back when their baby's barely 2 months old. So how do you feel that the cultural, just the way that our culture looks at pregnancy and the postpartum period, how can that have a negative impact on new moms?
Yeah, well, I think you've hit the nail right on the head in terms of North America, particularly not having that postpartum phase built in to our kind of cultural norm, and definitely not our health system. And I think, let's see, I am coming from Mexico, where there's the cuarentena, which is 40 days after baby is born, is kind of the time period, that sacred time period that you're talking about, where it's just, I mean, you're just laying low and other people are taking care of you. So it was the norm for me to think about, well, who's going to cook during this time period, or who's going to help me do the laundry, as opposed to having it framed as something that I needed to kind of bounce back from. I think you hear that terminology a lot, like as you're mentioning, the Hollywood, get your body back or bounce back from your pregnancy, which I don't know about you, but I hate that term.
Yeah.
And so I guess I'd replace the bouncing with like the transition, like honoring that transition period, and both, working through fertility issues, like that can be a huge transition period to shifting your mindset to, thinking about how am I going to deal with this challenge, to the pregnancy transition through the postpartum transition. And we think about so many different life events as transitions, but we often don't think past baby being born for this particular life event.
Well, and I think that if you have any struggles, or if it takes longer to get pregnant than you thought it would, so much energy has gone into that. So like you said, it's that transition of thinking about preparing for baby. And I think that I feel like there's kind of this unrealistic, I don't know where it comes from, but kind of this unrealistic idea that when you become a mother, everything's going to be wonderful. I mean, being a mom is a wonderful thing, but it's really challenging. It can be really challenging with a new baby, especially if you don't have the support. And so if you don't have that built in culturally, where there's an expectation that you're not going to do the laundry and the cooking for 40 days at least, plus. If you don't have, say, your mom to come, or your sister to really be actively kind of involved and really actively helping you with the baby and coming and staying with you and all those types of things, then it can be really challenging. I remember a long time ago when I first had my first son, so that would be about 3 years ago. And I was chatting with one of my girlfriends who has, she hadn't had any children at that time. And I remember saying to her, just in passing, that there were some days where I didn't, even have the time to run downstairs and throw in a load of laundry, or I forgot to eat. And it was only because my kind husband made me breakfast that I even had anything to eat, because it's hard to imagine just being so, it's really hard to imagine until you're in that situation. And I remember her saying, well, of course you'd have time to throw in a load of laundry. And I remember being like, oh, and then just dropping in and, graciously talking about something else. So that brings us back to why it's important to have conversations with new moms, or other moms in the same stage, or friends that have been through those stages, so that, again, you can really have that degree of understanding. As I'm sure you can appreciate that comment, being that you're in the middle of it right now.
Yes. Yeah. And I mean, the type of women that I tend to work with and that I think of myself as are, women who like to have a lot on their plate and do a lot of stuff and, are consider themselves productive and, have a professional life that they enjoy and that they take pride in doing. And so in thinking and preparing for some of those immediate weeks postpartum, it really is like, okay, what are my basic survival needs and how can I make sure those are met? And really shifting how we think about the question of like, was today a good day? Did I get done what needed to get done? And thinking of like, did I do what needed to get done in order for myself and my child to be healthy and alive, and taking it down to that basic level.
Yeah, no, absolutely. And so a question I have for you then is, what happens to the woman then who doesn't necessarily have, or doesn't even really think that she'll need it, maybe the support. So either doesn't really have, someone to come and hang out with her in those first couple of weeks and help her with the baby and those types of things, or just the woman who thinks, I got this. So what happens if a woman tries to do that all? Like, what if you have have your baby and you think to yourself, I can handle this, and you're still kind of responsible for the cooking and the laundry? Like, I guess, what happens to her if she really tries to do all of it after then a couple months?
I mean, I think you touched on the whole adrenal fatigue issue early on. Even the healthiest of women going into pregnancy and giving birth, having, a perfectly normal health status, no major health issues, it is going to take a toll on your nervous system. The sleep deprivation in and of itself takes a toll on your nervous system. The nutrition, as you mentioned, trying to figure out, when do I make a meal for myself? And so what we see in terms of long-term health outcomes are kind of a steady decline in maternal health. And what we know now is that children's health depends pretty heavily, is correlated with maternal health. And so, a lot of kind of in layman's terms, a lot of moms might think, well, I'm going to prioritize my baby and, I can let my health fall to the back burner. But what we know from empirical evidence is really you have to put your own health take it off the back burner if you want your child to thrive, because a big part of their health outcomes are going to rely on how well you're able to take care of yourself as well.
And I guess maybe you could delve into that a little bit further. Is it that, a tired mom is going to be more or rather less patient, or those types of things? Why does it correlate where if mom isn't taking care of herself, baby's outcomes are worse?
Sure. So we can think of two clear examples, but let's say mother's nutrition. So that might directly impact breastfeeding and ability to produce at, hydration and breast milk production. And if you have certain breastfeeding goals in mind, then taking care of your own caloric intake, nutritional value is going to affect being able to meet your goals and produce, let's say you want to breastfeed for a year and a half to be able to go that long. And another great example is on the mental health side, when we look at issues like postpartum, kind of the perinatal mood disorders spectrum. So things like postpartum depression or postpartum anxiety, even postpartum psychosis. I mean, really, when we look at mental health functioning for new moms, child developmental milestones are correlated with those levels of functioning. The intricacies are complex. Especially mental health researchers don't know, what exactly is impacting children's outcomes based on maternal mental health outcomes, because children are resilient, right? They lots of folks didn't grow up in perfect homes and are functioning, healthy adults. And so, child, both psychological and physiological development are robust little guys and can get through a lot. But there is this kind of long-term correlation that has lots of different components, lots of different factors. But in the two examples I gave, breastfeeding and maternal mental health, it's figuring out how can the child's health be optimized by decisions or support or care provided to the mother during those critical few months. And so any negative outcomes might not be seen in the child until way down the line. But we know that tracing back to those first few weeks and months during pregnancy and postpartum can have a role to play in the long-term health.
Yeah, absolutely. I think that one of the things that comes to mind when a woman gives birth, when a woman has a child, what happens for her hormonally is that during pregnancy, she has this super high levels of all different kinds of hormones, but, estrogen and progesterone specifically are very high. And then after she has the baby, there's this dramatic drop, right, in her hormone levels. And so ask any woman to talk to you who's had a baby about how she felt those first couple days after she had a baby. Not to say that she felt bad or sad or anything, but you just feel a bit fragile. I mean, you've just been through an experience, whether you had a cesarean section or a vaginal birth. It's an incredibly intense experience to give birth to a human being, however that happens. And that coupled with the emotional changes, the hormonal dips, and you're just kind of more emotionally fragile. Like, if there was ever a time that you could drop a glass and start to cry in the kitchen, that would be the time. That's just a silly example, but you get what I mean by that. So it's just so important that during that time, a woman is really taken care of. And that's something I hope that the listeners get from this conversation. Because especially if you're, you function not high, what am I trying to say? Like, you're
type A.
Yeah, that's what I'm trying to say. It must be too late on my end. But yeah, like type A women really take charge personalities. Like, even like myself, I get a lot of things done in a day, and you don't really think of yourself as needing to be taken care of. And you will, for a little while.
Right.
And, I did a podcast episode with Sally Fallon Rao. I wanted to bring that up because in that episode, so it's episode number 9, I'll link to it in the show notes page, but she really spent some time talking about the importance of nutrition, especially for breastfeeding moms, because I was even told by my doctor that, I was told when I was pregnant that, just eat, don't really worry too much about what you eat because the baby will get what it needs. And same idea with breastfeeding, kind of my doctor kind of told me the same idea. And I'm sure many women's physicians have told them the same thing. But it turns out that a mother's nutrition is intimately connected with her breast milk. And so like if anyone wants to hear more about just the nutrition aspect for breastfeeding, I would suggest to take a listen to that podcast episode because, I could tell you that eating differently, high nutrition, it makes a huge difference in the quality of your milk. Getting enough healthy fats, you can even see it. If you're not getting enough healthy fats, your breast milk will be like kind of bluish. And so now when I pump, I have like this thick layer of fat on top of my breast milk. It makes a huge difference.
Definitely.
And I wanted to ask you also to talk a bit about postpartum depression, and because you touched on that. So why is it so prevalent?
I mean, there's some interesting, depression overall has really increased in terms of what on a global level. Part of it is, okay, we're doing a better job of assessing and diagnosing. And then some people might say, well, is it just that it's being diagnosed more and it wasn't being diagnosed as much previously? And some people are attributing it more to a ever increasing everyday level of stress because depression is so intimately tied to the nervous system and to chemical imbalances that prolonged chronic stress can take a major toll on mental health and can be one of the main factors in depression. Obviously, for the postpartum woman, the change physiologically that happens can be a factor in postpartum depression. But one of I mean, what some of the most recent literature says is that the women who are most at risk for postpartum depression are those who have a history of depression unrelated to pregnancy or postpartum. So it usually doesn't kind of pop up out of nowhere. So that aspect of stress combined with sleep deprivation, postpartum depression has continuously been getting more and more attention. And especially as postpartum psychosis has made kind of some major news, mainstream media has started covering it. So I would say it's a combination of being able to better diagnose and assess, and also a decreased stigma, or at least a move in that direction about decreasing stigma around talking about some of the postpartum realities.
Mm-hmm. Well, and maybe you could just elaborate, what is postpartum psychosis for the listeners who aren't sure what that is?
Mm-hmm. So postpartum psychosis is a mental health condition that some of the signs and symptoms are feeling like you are going to harm yourself or your child. So suicidal and homicidal ideation is kind of where it crosses that line. So it's where functioning is depleted to the stage that you really cannot take care of yourself or your child. And that postpartum psychosis usually requires hospitalization and medication.
Well, and those are the horrible stories that we hear about in the news every now and then, where a mom has done something to her child or something like that. Is that
right?
Yeah. So we've been talking a lot about support and how important it is to have some sort of support. I think especially like acute after in those first couple of weeks, I think it's most acutely necessary, but it doesn't mean that a woman doesn't need that support throughout. One of my friends just posted on our Facebook the other day, it takes a village, and we can all laugh and nod our heads, but it's so true. And you realize it when you become a mom. You really realize that it does take a village because you really need that support. But I did have a question in there, and it was the relationship between the support that a woman has, so the level of support that she has, and her likelihood of suffering from postpartum depression. Are those things connected at all?
Yeah. So one, that's the whole kind of the mental health movement towards support groups has really been driven by some of the strong research evidence we have that social support, meaning having a support group of your peers, even led by a peer, as opposed to something like going to private therapy sessions, that support-led peer group can be very important in reducing active signs and symptoms of postpartum depression, as well as anxiety. Some of them, some of the symptoms overlap, some are really different, but just under the umbrella of perinatal mood disorders, both of those, depression and anxiety. And so that is one of, the maternal mental health organizations that are really championing changes in practice, are calling for, a focused engagement on having treatment include support groups and peer groups.
Mm-hmm. Well, and maybe we can shift and then talk a little bit about some of the practical things that a woman can do. So if a woman's listening to the podcast now and she is pregnant, what types of things can she do with all of this in mind to just improve her own experience postpartum, and to keep these things in mind, but in a practical way, kind of setting herself up for just a more positive transition into motherhood?
Yeah, well, so time that you have now that disappears once the baby is here, I would use that time to develop and look up a list of resources for you to have kind of at the ready, even if you are one of those people who think, I'm going to be fine, I have it under control. So that might be planning something like a meal train, which is, it's one of those handy online things where you can get your friends to sign up for and deliver meals for X amount of time postpartum. It might be something like looking up support groups in your area, or looking up new mom groups that are unrelated to mental health in your area, and having contact info for those groups. It could be, even if you have a history of any mental health issues, looking up a few mental health professionals who specialize in maternal mental health, since that is, you'll definitely, you would want to see someone who has a specialized training in that area. And it's just, you don't have to call them. You don't have to establish contact and reach out with all these people. You can just have a list of phone numbers, or having a lactation consultant's phone number written down in the event that might be something that you need. And all of this kind of forward-thinking planning is, not assuming that you're going to need all these people, or that you aren't going to need all these people. It's not trying to make assumptions about what your experience will or won't be like. It's simply trying to have as many resources as possible beforehand, so that in the moment you aren't kind of grasping and having to do all this online research when you're in the thick of things.
Well, and arguably you'll end up in situations where you might have to do that anyways, because you just never know what's going to come up. I think the lactation consultant piece of it, my experience with breastfeeding was with both children, but especially with my first son, was that I had some real challenges, and my son ended up having to get, what's it called when they cut his frenulum? Do you know what that's called?
Yes.
Frenectomy. I don't remember what that's called. But he had to have that done because he had like a tongue tie. And so when he was eating, his tongue was in the wrong location, and it felt like razor blades on my breast. So when people say things like breastfeeding's hard, you nod your head and you're like, yeah. But by hard, it was like so painful that I had to stop breastfeeding him within like 36 hours of him being born. And then I needed support like stat. And all I can say was that I was really fortunate I was able to get support right when I needed it. It just kind of worked out. There was a nurse who had taught a prenatal class of mine who was really sweet, and she happened to be on call like that day. So I reached out to her just out of sheer desperation because I didn't know what to do, and she was able to come in that following morning. I guess what I'm saying is that you just never know. With breastfeeding, I would say having that lactation consultant's number or something like that can mean the difference between you being successful and being able to continue breastfeeding and not.
Yeah. I mean, I feel like the more resources you have available, if you don't use them, you can always pass them on to some other mother in need. What's the harm in having them?
Yeah, no, those are great suggestions. And one thing I would love to hear if you had a similar experience. When I was pregnant, I didn't really have any motivation to like look into a bunch of stuff until I hit my third trimester. It was really strange. It was like this third trimester nesting thing where second trimester is like, I was cool, I was good. And then all of a sudden, third trimester, I was making the baby room, and all of a sudden it just, you just kind of get that nesting urge. So if you're, newly pregnant, you don't need to run out and do all of this now. You might wait for that natural urge to to go and do all these things.
Yeah, I was very sick my first trimester. So once I got my energy back second trimester, I kind of became my own client and basically took myself through all the planning that I would normally do with anyone else. And, it took time, and it took, lots of delving into thinking about things that seemed like they were far away. But in the end, I'm glad that I pushed myself to do, to walk the talk and do the things that I would recommend and that I normally do recommend for others.
Mm-hmm. And as you were going through some of the practical ways to kind of prepare and set up different supports, we've mentioned the food thing has come up several times, but it can't be understated how necessary it is to have access to food for those first couple weeks without having to cook it. That's just, it can't even be understated. But something that came to mind was not overscheduling yourself and really dialing back on the expectations for those first couple weeks. Because you just don't know what it's going to look like. So I don't know, maybe you could talk about your own experience, and if you feel like that could be something that would be helpful for women, not to kind of plan all these family get-togethers and all kinds of stuff right after the baby's born.
Yeah. And, this is something that I've really seen postpartum doulas kind of excel at doing, which is if someone's coming over, they're doing dishes, they're holding baby so you can shower, they're doing a load of laundry, they're bringing you some food. Like those are the rules under which people should come into your house, which once you've been through it, you're like, yes, of course. And honestly, anyone who comes should make your life easier, not more challenging, is kind of my approach on that.
Well, and one of the topics that we didn't get to yet was some of the ways that you support your clients and support women in general as they're making that transition, not just to motherhood, but also back to work. So maybe you could talk a little bit about that transition and what, if anything, we can do to prepare for that.
Right. Well, in my mind and practically, it divides into kind of those two things. What's some of the more mindset issues that come up, and what are some of the logistical issues? So on the mindset front, it's grappling with what I mentioned earlier, some of that professional identity and how does that merge with my motherhood identity, and especially when you've spent so many weeks where your job is 100% to be a mother 24/7, then it can be challenging to think about how am I going to balance that job with my kind of professional work-related duties, and thinking about what does my motherhood identity mean for my professional identity, and what does my professional identity mean for my motherhood identity? And everyone kind of grapples with it differently. I know for myself, I thought that I would want a long time to just focus on the work of motherhood and not focus on any of my consulting work. And then when I had the baby, by 6 weeks, I was like, there were some moments I was like, I wish I could, do something work related now. And then there was kind of the mom guilt around that. And I was like, no, I have this newborn to take care of. So trying to figure out for myself what does, being a working mom mean? Mm-hmm. And everyone has their own experience with that, right?
Yeah, I think that, I think it's real. There's so many layers to that. And from the unexpected part of it, where you might really think that you'll be one way about it. So you might really think that you'll be itching to go back to work and find out that you're not. Or you might think that, like you said, that you would totally just be enthralled and just want to immerse yourself in mommyhood, and then really kind of be wanting those adult conversations and, mental stimulation. So part of it is unknown. You don't necessarily know how you're gonna feel about this transition. And so when you have, what I would want to ask you then is, what about that mommy guilt? So the mommy guilt when you do go back to work. What if you like it? Well, no, I'm just being silly there. But the mommy guilt about, you have a job, after spending all the time wrapped up with your little one, and then you go to work and you leave your baby. It's so hard. Even if you love your job and you are itching to go back, it doesn't mean that there's not going to be any mommy guilt.
Right. So, you hit two things kind of right on the money, which is the navigating the unknown. So it is going to be unknown. Even if you think you're going to feel a certain way, we can't predict, right? And so thinking about how to how you will best cope with navigating the unknown. Whether that's having, a partner who you can talk to about these things, work people who you can talk to about these things, and the guilt part. What comes up for me is that we can be so hard on ourselves. And I'll just say I can be very hard on myself. And so for me, what helps and what something that I, again, practicing what I preach, walking the talk, is figuring out, what would I say to a friend who was in this situation? And most of the time, I probably would show that friend a lot more compassion and kindness and patience than I'm showing to myself. So being able to take a step back and kind of be that friend, think of myself as a friend and be patient and compassionate and not so judgmental of myself and my decisions.
I think that's great advice because it's so true. We're so mean to ourselves. You wouldn't have any friends if you talk to your friends the way you talk to yourself sometimes.
Exactly. I know.
Well, and so one question that comes to mind in our discussions in terms of preparing for motherhood and preparing for that transition back to work. Can you even prepare? Is it a thing? Can you really prepare?
I think you can prepare. So short answer is yes, I think you can prepare. The long answer is you're preparing for figuring out how to deal with whatever emotions arise, as opposed to preparing for specific emotions or specific events or specific things, because those are always going to be in flux. And so the preparing for navigating the unknown with kind of grace and ease, as much as that's a possibility, is kind of the foundation of that level of preparation that you can plan for, knowing that everything will, every day is going to be a little different and a little new and a little crazy.
I think giving yourself permission to feel whatever, because I think that it's really important to put that out there, that you can have really specific ideas, and a lot of us do, especially, like I know my listeners I just did a survey, so it was really cool. I got all these responses from my listeners. So it's kind of like having a little conversation with all of my listeners. And so I know my listeners are really thoughtful and just really sweet. And all of us women are just trying to do our thing. We're just trying to figure out how this all works. Women who are wanting to have children, how to fit that into your career and your relationship and your children. And we're just trying to kind of figure this all out. And so you really end up with, I think, often really strong views on whatever it is. Like, I'm going to do things like this. I'm going to raise my kids like that. I would never do that. And then when you find yourself in the situation, you might actually do something that you never ever thought you would, or you just might be surprised at how you feel. You might have thought you would have felt differently. So I think that that's really, just a really nice way to, although you can never prepare for what's going to happen, to really kind of give yourself that space.
Yeah. And you can find a way to be like, it can be pretty uncomfortable to not know what comes next. And so figuring out a way to be okay with the not knowing is often a great first step.
Well, one of my very wise friends is a labor and delivery nurse. And one of the things that she used to, we used to talk about this a lot, is that when a woman goes into her birth with a really specific idea of what she wants, that type A personality, you kind of want to control everything. And you kind of want it to be a certain way, then what happens? You don't get what you wanted. Like, so when you're it's true. And I always think of it as a literal metaphor for motherhood, which is that you are no longer in control, because your kid is a wild card. They come out with a personality. They're their own little person, and you just have no idea who this little person is going to be and what types of challenges this little person is going to come with or bring to you. and the ways that you'll have to grow as a person. It's this really amazing opportunity for growth. And so I feel like one of the I love our conversation, and I love that we're talking about the postpartum period and really kind of delving into it, because I don't think it's talked about. I don't want to give the impression that you can actually plan for everything and everything will be great, because it's good to have this dialogue and to really try to get starting to think about it. But at the end of the day, there's no like control here. Like you can't control how it's going to be.
No crystal ball.
Yeah. And if you really, it's almost like if that's the type of person that you are, and you really have a real specific idea of how everything's going to play out, it often doesn't work that way. You often get curveballs, right?
Yeah. I mean, it's like the only constant is change type of thing.
Well, as we wrap up our interview today, is there anything that stands out for you, given our conversation today? We've been talking about the postpartum period and preparing for that transition to motherhood. Is there anything that stands out that we haven't really touched on that you wanted to share with our listeners?
The direction that we've been taking the conversation, which is figure out things that are figure outable, and have patience with yourself in knowing that there's a lot of stuff that is not figure outable until you get in that moment.
I love that. All right. Well, a couple final questions for today then. So what advice then, I mean, we've gone through a little bit of this, but what advice, if any, would you give to a woman who is pregnant now and really just looking to kind of ease into motherhood?
I would say think about what your ideal postpartum experience, what that would feel like, what that would look like, what kind of people in your life that would include, and to the best of your ability, think about what kind of help you would need to make that happen. Again, not being wedded or locked into any type of plan in particular, but knowing what resources you want at your disposal and then being able to have those within reach. That'd be my top takeaway.
Mm-hmm. Well, and any advice for women who are not pregnant, but kind of planning to or thinking about pregnancy or even trying at the moment?
Yeah, I would say let yourself think beyond the birth plan. We can be so wrapped up in that moment when we will have a baby that it's hard to see beyond that. When really it's like the beginning in many ways. So allowing yourself to see across that horizon.
Mm-hmm. Well, I think those are great words to end on. Well, Ariana, I'd like to thank you so much for being here today. It was really nice chatting with you. And I really appreciate that we were able to talk specifically about the postpartum period and the importance of support, having support, and just to really kind of start that conversation, because I think that there's so much out there about fertility, which is super important, and pregnancy, which is also important. But then we kind of forget the moms after. And us moms have to figure this stuff out. So it's really important that we have these conversations so that we, we don't get forgotten in the mix after the babies are born.
Yeah. Couldn't have said it better myself. Thanks for creating the space to have the conversation.
Oh, well, you're welcome. It was my pleasure. And for our listeners then who are interested to find out more about you, where can they go to learn more about what you do?
I have my website's probably the best place. It's just my name, first and last name.com, arianatabawada.com. And so I'm sure it'll be up in the show notes. And I'm on social media, nursing with one eye on Facebook oftentimes. So if you want to chat more, please don't be shy about reaching out, and I'll be sure, Lisa, to send you some information to have up there when the episode airs.
Okay, perfect. Well, thanks again for being here. It was a lot of fun.
Yes, it was. Thank you.
thank you for listening. I hope you enjoyed today's episode with Ariana. I love talking about the postpartum period and why it's so important for new mothers to be taken care of, especially during the first few weeks after having a new baby. Having that support allows new moms the ability to ease into motherhood and also gives new moms the freedom to enjoy their new little one without the wall of stress that comes with having to do it all after the baby's born. If you enjoyed today's show, please share it with a friend. You'll find the show notes page for today's episode at fertilityfriday.com/87. If you've been enjoying the podcast, please look for it on iTunes and leave a 5-star review so that more people can find it. And make sure to head over to fertilityfriday.com and join my email list. If you have an idea for a podcast episode or a guest suggestion, send me an email at info@fertilityfriday.com. Thank you so much for hanging out with me today. I appreciate all of you for taking the time to tune into the podcast, whether you're on the go or commuting to work or walking the dog or doing the dishes or whatever you're doing today. Thank you so much for hanging out with me. And as always, until next time, be well and happy charting.